Hey everyone, and welcome back to the MediByte channel. I'm your host and a healthcare professional, and I am absolutely thrilled you're joining us today. Whether you're a healthcare student, a patient looking for some clarity, or honestly just a curious learner who loves figuring out how the human body works, you are definitely in the right place. Today, we're unpacking a very specific medical condition that can honestly be pretty confusing and sometimes a little worrying for patients: Skene Gland Cysts. We're going to break down exactly what they are, why they happen, and exactly how we treat them in the medical world. So let's jump right into this explainer. Here is our clinical roadmap for today. We'll go through 1. Meet the Skene glands. 2. How cysts develop. 3. Recognizing the symptoms. 4. Other common vulvar cysts. And finally, 5. Diagnosis and medical treatment. All right, let's start with section 1, meet the Skene glands. Okay, so to understand a cyst, we really have to understand the normal, healthy anatomy first, right? We're focusing on the external female genital area, which is known as the vulva. The Skene glands, which you might also hear doctors call the periurethral or periurethral glands, are these little structures positioned right around the opening of the urethra. And the urethra, just as a quick reminder, is the small tube where urine actually leaves the body. Now, these glands are a completely normal, natural part of the female anatomy, but because they're located literally right next door to the urinary tract, if something goes wrong with them, it can directly mess with how a person urinates.
Moving right along to section 2, how Skene cysts develop.
So here's the deal. A cyst basically forms when a duct gets blocked. Think of it kind of like a plumbing backup. The Skene glands have these tiny little ducts that drain their fluids. If one of these ducts gets obstructed for whatever reason, that fluid suddenly has nowhere to go. It just builds up, swells, and forms this little closed sac. And that right there is what we call a cyst. Now, it is totally worth noting that Skene gland cysts are actually quite rare, and when we do see them, they almost always pop up in adults. I know that whenever anyone hears the word cyst, it's super easy to get alarmed. But I want to reassure you right now, most of these cysts are incredibly small. We're talking less than 1 centimeter, which is about ½ inch in diameter, smaller than a dime. In the vast majority of cases, they don't cause any trouble at all. A patient could have one of these right now and never even know it's there because there are literally 0 symptoms. But what happens if it does happen to grow a bit larger? That brings us to section 3, recognizing the symptoms. Well, if a Skene cyst grows large enough, it essentially becomes a mechanical issue. Because it's sitting right next to the urethra, a big cyst acts like a physical roadblock. It can actually block the flow of urine. This causes some highly frustrating symptoms, like a hesitant start when you're trying to pee, maybe some dribbling at the end, or even urine retention, which is where the bladder just can't fully empty itself. On top of all those plumbing issues, the sheer physical presence of this swollen sac can make both sexual activity and urinating quite painful. And this is where we see a real domino effect in the body. If that trapped fluid sitting inside the cyst becomes infected, it can actually trigger a urinary tract infection, or a UTI. Suddenly, the symptoms just escalate. The patient might start feeling this frequent, urgent, and usually highly painful need to urinate. Why? Because the infection right there near the urethral opening makes the entire urinary tract incredibly sensitive and inflamed. Now, in very, very rare scenarios, that infected Skene gland cyst can evolve into an abscess. An abscess is essentially a localized pocket of pus. If a doctor examines this, it's going to be incredibly tender, really painful, and visibly swollen. You'll literally see red skin directly over the gland's ducts. But here's an interesting quirk and a really good clinical takeaway for you. Most women who develop a Skene gland abscess don't actually get a systemic fever. The infection stays completely contained to that one specific spot. Let's broaden our view for a second with section 4, other common vulvar cysts. To really demystify all these different kinds of bumps, we need to compare the 2 other main types of cysts you might find on the vulva: vulvar inclusion cysts and vulvar epidermal cysts. Let's break down exactly what makes these guys different from each other and how they differ from the Skene cysts we've been talking about. First up, we have vulvar inclusion cysts. Believe it or not, these are actually the absolute most common cysts found on the vulva. Now, unlike Skene cysts, which remember are all about blocked gland ducts, inclusion cysts are actually about trapped skin. They are these small sacs that contain epithelial tissue, which is really just surface skin tissue. They very frequently pop up after some kind of past trauma or injury, like a tear from childbirth, for example. What happens is the surface tissue gets pushed down underneath the skin while it's healing, gets trapped there, and boom, it forms a cyst. On the flip side, we have vulvar epidermal cysts. These are much more like what you typically think of as a standard skin cyst. They happen when the ducts to your sebaceous glands, those are the little guys that produce oil right near your hair follicles, become blocked. So all those oily secretions just accumulate right under the skin's surface. To sum that up, inclusion cysts are trapped surface tissue, while epidermal cysts are blocked oil glands. Visually speaking, both inclusion and epidermal cysts look pretty darn similar. They're usually white or maybe a bit yellow, and just like most skin cysts, they are tiny, less than 1 centimeter across. Usually they are totally asymptomatic. You might get a tiny bit of occasional irritation, but that's it. However, if they get infected, just like any cyst anywhere on the body, they're going to get red, they're going to get tender, and they can definitely make sexual activity painful. All right, let's wrap this up with Section 5, diagnosis and medical treatment. Getting a diagnosis is usually super straightforward. Doctors can almost always identify and diagnose these cysts simply by feeling them during a standard routine pelvic exam. Easy as that. But let's say a cyst is unusually large, complex, or the urinary symptoms are really severe. In that case, they might use an ultrasound to get a better look. Sometimes they'll even use a cystoscopy. That's a procedure where they pass a very thin, flexible little viewing tube right into the urethra to check out the bladder and just make absolutely sure the cyst isn't causing any deeper urinary blockages. If a cyst, and it doesn't matter if it's a skene, an inclusion, or an epidermal cyst, is actually causing symptoms, the standard go-to treatment is simply to take it out. We just remove it. This is usually done right there in the doctor's office. They'll use a local anesthetic to completely numb the specific spot. Now, if a patient happens to have several cysts that need to go, the doctor might step it up to a regional anesthetic to numb a larger area, or sometimes even a general anesthetic so the patient is totally asleep during the procedure. Now, for Skene Gland Cysts specifically, doctors have this incredibly effective outpatient technique called marsupialization. I know, marsupialization. It sounds like a wildly complex medical term or something to do with kangaroos, right? But the concept is actually brilliant. The doctor just makes a tiny cut into the cyst, drains the fluid out, and then here's the clever part. They stitch the inside edges of the cyst outwardly to the surface of the vulva. It essentially creates a tiny, permanent little opening, like a pouch. This ensures the gland can continually drain whenever it needs to, which literally stops the cyst from ever filling back up again. But wait. What if that skin cyst has already turned into that really painful abscess we talked about? Well, you can't just cut into a raging active infection. So that requires a very specific 2-step game plan. Step 1. The patient takes oral antibiotics for about 7 to 10 days. This cools things down and completely clears that active infection. Once the infection is totally gone, we move to Step 2, which is the physical procedure. The doctor will either completely remove the cyst or perform that marsupialization procedure we just went over to guarantee it doesn't come back. Wow, we have covered a lot of ground today. We went all the way from the basic anatomy of the Skene glands to the very specific steps doctors use to treat them. Demystifying these symptoms is absolutely the first step to seeking out professional medical advice and getting some real relief. So I want to leave you with this final thought. Could that unexplained discomfort you or someone you know is having just be a simple, highly treatable cyst? Knowledge is power, folks. Thank you so much for joining me today. If you found this explainer helpful, clear, and easy to digest, please go ahead and hit that like button. Share this with anyone who might benefit from understanding their body a little bit better. And be sure to subscribe to the MediByte channel for more clinical explainers that break down complex health topics. Until next time, stay curious and stay healthy.